Alrighty. We are live. Welcome again to another episode of Flowdoe. I think I'm on episode 7 at this point. Just check whatever number I put this down as. I'm here today with Tom Gurney.
Hi, Julian.
Yes, so Tom here, he was actually in my last live stream, and then he reached out after the live stream and said that he wanted to be on this show, and I was like, "Oh, that's pretty cool." So we're
Thank you
getting
for
places.
having me. Appreciate it.
Yes, we're getting places. So I would like to start off. Let's start off with what you wanted to talk about, which was music therapy and what that can do for the mental health of
Well,
people.
This is to begin. I wanted to really follow up in your last Floto number 6 or whatever it was, episode 6. You invited Ray Remish, local musician and educator, to the program and to talk about a lot of his projects and his deals. And the subject turned to a little bit of education, and at which point I kind of jumped in. And of course, anybody who is streaming this or online can, I understand, enter a chat, and
Yes.
and it is interactive, and invite that. So I interacted. And that could be a good thing or bad thing. You could end up with Floto number 8.
Yes.
But Ray raised the issue, and I raised the issue of children being ready to learn. So much in our education system has been constrained over the past 2 years, and certainly even before, by the impact of the pandemic and all the restrictions and that imposed, legally or illegally. That's your choice. But it is what it is, and I hate to use that word because it's not always what it is.
Yeah.
It is a delusion sometimes.
Yes.
So it is what it's not.
Yeah.
But I think, to the point, to follow up onto that subject, children, I think one only has to look back on their own life and saying, how did I learn? What were the influences in my own development? What can I remember about learning? And I think, to start off with, as a music therapist and as a musician myself, and I think Ray kind of concurred with this, that children learn a lot through music, whether it's rote learning, just repeating things over and over, or using a multiple sensory input, rhythm, melody, combined with lyrics. I mean,
Yes.
Julian, how did you learn your ABCs?
Yeah, through the ABC song, ABC.
Yeah, A, B, C,
That was-
D, E, F,
that
G.
was the
and,
rhythm, yeah.
and that cements into the brain, specifically, a number of inputs: rhythmic, melodic, the words,
Yes.
and then you get, now I know my
Yeah.
ABCs.
Yeah.
Next time, won't you?
Yes.
You know, and then
Yeah.
so there's that pride, and there's the self-esteem. So music affects behavior on so many different levels. And as a music therapist, we know that music affects us on the cognitive level, on the emotional level, on the physical level, the physiological, helping to control various aspects, even of our breath, of our
Yeah.
of just our and our gait, and we can talk more about that later.
Yeah.
But the impact of music, or the influence of music on behavior, is significant developmentally for people who are ready or becoming ready to learn.
Yeah.
Talking with numerous educators and teachers, both at the pre-K level, and in the early elementary grades, and even into middle school. Teachers express concerns that children aren't ready to learn. And when they're not ready to learn, it's hard to control classroom behavior.
Yes. Yeah.
And so readiness to learn implies a number of things. And there are a number, of course, laws and regulations that are in place to help a child. I'm not a music educator per se, but we have things like a 504 plan or an IEP, depending on what the child may be presenting and whatever diagnosis has been attached to that behavior, um, so that children have the tools. Now, as a music therapist, I play roles of that are very unique in the education system. Same with the speech and language pathologist, same with OT or PT person. Music therapy is a related service under the Individuals with Disabilities Education Act, IDEA. And in that perspective, music therapy can be used in the schools, and the parents have to really advocate for their child. So when we go back and we look at early child development, how does a child thrive? How is he showing signs of social engagement, of cognitive engagement? And the pediatricians, do well baby checks, and
Yes.
Are we on track? Are we meeting the milestones for child development? This is a really critical period, and I tell mothers who prenatal, who are pregnant, have the baby in the womb, sing to that child, bring vibrational things into it. Sometimes I would have a person even lay an instrument on the womb, on the belly, and strum an open tune guitar or a dulcimer or another instrument, or but mostly sing. We all have a voice, and that voice needs to be heard in utero.
Yes.
And establishing that relationship is wonderful. I had a coworker who is an art therapist at the hospital where I work, tell me, "Oh yeah, on the way home, I'm singing to my baby." And
nice.
and we make that connection. So even before birth, we have a child who is receptive, who is hearing. And it's interesting, doctors who work in end of life care have studied this and shown that in many respects, hearing is one of the last senses to leave. So it's one of the very earliest of senses, and it's one of the last senses. So music is a lifespan event. Music and the voice. When was it? Almost a year ago now. The area behavior services had mental health across the lifespan conference. And I presented at that conference on the use of music therapy. Now, I used the dulcimer, and I guess I should have brought one in to show another date. But the dulcimer is a stringed instrument. The Appalachian Mountain dulcimer is usually played on the lap, and it's very visual, and it's set up in such a way that you can just strum it without playing any melody at all. And the vibration just in itself presents a calming effect, if you will, or an energizing effect.
That's kind of cool.
One of the things that you discussed last week with Ray and that I joined in on is I said that rhythm, one of the elements of music, rhythm is the energizer and the organizer for the brain.
Yes.
So when a early child educator wants the class to be in order, they may just do this and get that response, right?
Yes.
Or crisscross applesauce. They're using rhythm as an energizer, but also as an organizer, calling the class to order, if you will.
Yeah.
And literally to order.
Interesting. Yeah, that's very interesting. I know. Hopefully you don't lose your train of thought when I interject here. But yeah, I never really thought of it, I guess, like that, with that whole, rhythm type of beat, I guess you can say. I guess that's why, a lot of the, I guess, peacemaking tactics are very, auditory sounds type of ordeals, whether it's a siren or if it's like, I guess, a certain rhythm, I guess. But yeah, never really thought of it like that. But yes, continue. I know I was just
Well,
interrupting
I
for a
mean,
second.
just to take that thought just one step further, that rhythm, that music, the effects of music cross domains: physiological, cognitive, emotional, social, emotional, spiritual. So that music is multidimensional. Now, the brain has certain areas for speech, certain areas for vision, certain areas for higher level thinking, certain areas for the flight or fight response,
Yeah.
um, uh, and autonomic nervous system responses, automatic responses, but they can be influenced by music. There is no single music center in the brain because music crosses the corpus callosum and music impacts so many areas of the brain. Give you an example. In music therapy, music therapists, especially trained to use what we call melodic intonation therapy, have used this in the course of rehabilitation for stroke patients. So,
Oh.
somebody that you've had a stroke or other traumatic brain injury, in which, say, speech has been impacted, will reteach language, reteach the use of the language, the phonation, the various uses of the muscles, even of the
Oh.
mouth, to retrain muscles and bypass the damaged speech center of the brain to engage other
Oh.
parts of the brain. So, music is a whole brain experience.
Mhm.
And the science is just so fascinating with this. Maybe your listeners would remember a case in particular of a United States Congressman, Gabriela Giffords from New Mexico, I believe, who
Okay.
was at a campaign stop and was shot at her
Oh.
campaign stop, in her campaign stop, and had a severe brain injury where she couldn't
Oh.
speak. Now, I had the pleasure of meeting and talking with the music therapist who treated her
Oh.
at a conference a number of years ago. But they worked together with their OT person, the PT person,
Yeah.
the speech and language person in a comprehensive effort to restore speech. And in the course of that, they use melodic intonation therapy. Hello,
Oh.
how are you? I'm fine, thank you. And so we do, or somewhere. That's a whole octave
Oh.
over the rainbow. And sometimes, and I've done this with persons who were suffering various levels of dementia, Alzheimer's disease, perhaps,
Mhm.
um, or even children with speech and language issues. Now, I'm not a speech and language pathologist. I don't diagnose. I want to
Yeah.
make that very clear. That was very, but using music to train phonation, just the various parts of what goes into speech. So, what does
Okay.
this all come back to? It comes back to the child being ready to learn. Now, that child, I use in quotation marks, could be that child within us, within you, Julian, within me, within the person who's in the nursing home who needs to be engaged, the person who may not be as ambulatory as they once were, uh, and needs to be responding. One of the one of the opportunities I've had is to work in nursing home as a director of activities, and I worked specifically, not exclusively, but specifically every day with the memory care unit, the Alzheimer's unit. And I
Okay.
would do music that that engaged the person. Now, there's different levels of engagement. Some
Yes.
can engage while at one level and may have speech while another may not. Um, so, all of those influences have been, and all of those understandings have come later in my life.
Mhm.
But maybe I should step back and say, how did I get here?
Yeah.
How did music influence my life? Now, I don't know. I kind of suspect that I was influenced in utero
Oh.
because I was one of 10 children.
Oh, yeah. I do remember that. Yes,
I
talked about
was
that
I
earlier.
was number eight,
Oh, eight.
of 10 children,
Jesus.
and so I had a lot of voices going on around me, I'm sure, while I was in utero. But I also had a lot of music. I was exposed early to the music of the church, but I also remember after I was born, and my mother tells me this. I really don't have a memory of it, but she says that when she played the piano that was in our house, and I think she liked Brahms. I don't know. I'm just saying. She liked
Yeah.
Brahms, and so she would use the pedals, the sostenuto or the sustain pedal on the piano, and I would be underneath the piano, or I would be at her feet, and I would play with the pedals. And this was before I could even, according to her, before I could even really stand stably. But I do remember standing as a child and reaching up and hitting the keyboard of the piano.
Oh.
So playing with from at my mother's feet to playing with the pedals and putting my hand on her foot and feeling the rhythm and the vibration of the piano and having that probably had an influence on me.
Yeah.
So yeah, those are all early influences. In much the same way, everything that we present to children is a learning possibility. The saying, train up a child in the way they will go, and when they are old, they will not depart from it. Now, it doesn't mean they won't depart from it in the middle,
Yeah.
but
Yeah.
but that it just points to the importance, the necessity of having the relationship of music with a child.
Okay.
Now, is music therapy for everybody? No, I wouldn't presume that, and I'll probably explore that later with Bruce on Midshore Midday
Yes.
at some point. So when you think about the effect of music on the brain and music and rhythm as the energizer and organizer, then you start, well, gee whiz, we need to do some studies on the brain, and we need to talk about is there evidence to support this? Because if there isn't evidence, you're
Yeah.
just spitting into the wind, so to speak.
Yeah.
So music therapy is an evidence-based practice. One example, when talking about the brain, once again, we have now the ability to do brain scans, to do brain images.
Yes.
I work with persons who are suffering anxiety, and I see a lot more anxiety in these last 2 years.
Oh.
I work with people who are suffering depression and related issues, including substance use, of all stripes. No division. There's no prominence, one profession over another. I've had professionals. I've had people who were, just of no profession.
Okay.
I've had individuals who had had feelings of hopelessness. Why would I want to go on? So you're working with people who had suicidal ideations or even attempts.
Oh.
This is serious business. And music is able to engage people, and I dare say children who are talking to. You remember Peanuts, the Peanuts
Yes.
Charlie Brown thing,
Yeah.
and wah wah wah.
Yes.
Yeah, right.
Yeah.
Sometimes kids, that's a very real event for kids. They just have somebody talking at you all the time. Don't
Yeah.
do this. Don't do that. Do this. Do that. Yeah. You should. You should. You should. Well, Julian, I think we've been shoulding on ourselves for too long,
Yeah.
and then we got to quit shoulding on ourselves.
Yeah. Yeah.
So to go beyond music as the energizer and organizer for the brain, music is medicine. Now that's a pretty outrageous statement.
Yeah.
Wait a minute, how are you qualified to say what medicine is or what medicine isn't? And I'm saying on the basis of the evidence that is presented in neurocognition, in the combined studies of neuroscience and music therapy, we can see the impact of music on behavior. Whether it's helping a stroke patient maintain a steady gait as they're doing their exercises, whether it's down here at the YMCA going to your aerobics classes or your body pump classes. A little plug for the Y there. Today is open house for the Y. So if you've not been down to the Y, you need to get down there. So doing all those things that take care of you. But in all those classes, there's a common element. There's several common elements. There's the there's the verbal instructions. There's the visual prompts, but then there's also the music. You're always doing these exercises with some sort of music.
Yeah.
And in the case of the body pump, it's really a prescribed set of exercises to a specific music selections. I don't always like the selections, but I can see the benefit of the music. I don't try to keep up with the tempo always, because I'm working at my own pace. Much the same way with these children. Yeah. Much the same way with anyone who's receiving care. They're doing individualized care, and they're doing what they're doing to help. That's okay.
Yeah, that was something. Yeah, if you got, I know people on the stream probably didn't see that, but two people just kind of walked in. I don't know. They're kind of standing there. I don't know. If
that's
you were
okay.
expecting.
It was a mother and a child, and
Yeah.
or I would say.
Oh, they're coming back in again. Hello.
You're welcome.
It's all good.
Say hello.
Say hi. Yes, you're on stream.
Yes, that's what community radio is all about, right, Julian?
Yeah,
The
yeah,
community just walks
comes
in the
through,
door.
yeah.
Very good.
And does what they do.
So to get back to the train of thought, when we think about music as the energizer and organizer, we're thinking beyond just rhythm. We're making a connection to the music. We're making a comparison with the brain, for example, the brain that's suffering symptoms of depression, and it's a very inactive brain. I say inactive.
Yeah.
The brain's not lit up in the brain scans, but you add music, and all of a sudden, boom, boom, things are lighting up. So the kid that's experiencing wah, wah, wah all day long in the schools is not going to be as responsive to, we're going to need to take Johnny to a therapist because he's acting out in school, or he's not being attentive in class. Is it ADD? Is it ADHD?
Yeah.
Are we going to put him on this
How
medicine
many-
or this
yeah,
medicine?
How many medicines you can put on them?
And I would say that you have to use all the tools in the toolbox. I'm not discounting medications, but there's no magic pill.
Yeah.
Do some medications help to balance brain chemistry? Yes. And they help to kind of level off some spikes in anxiety and maybe help with states of depression? Yes. But I will tell my patients, as I tell educators, as I tell children, it's not a one-pill fix-it system.
Yeah.
Mommy and Daddy don't bring Johnny to the therapist. Sorry, Johnny, I didn't mean you.
Yeah.
Don't bring the child to the therapist and say, here's my kid fixing. No, that's the job of parents.
Yeah.
That's the job of
Exactly.
parents. Education is the job of parents.
Okay. I can
Yes.
believe that. Yeah. I
Yeah.
can get down
Do,
with that.
do we use educators? Yes.
Yeah.
To guide us, to help us. But ultimately, parents are charged with the job of educating their children. That's why when Johnny doesn't go to school, it's not the teacher that gets in trouble, but by law, it's the parent
Yeah.
that gets in trouble for
Yeah.
truancy.
Yeah.
Okay?
That does make sense.
So if parents are going to be legally responsible to have their child educated, then they need to educate their child.
Yes. That.
Duh!
Yeah. That's just that's as simple as it is. Point A, point B.
So tell me your experience with your own music
Yes.
or your own education and how music may have influenced your journey.
Yeah, I guess in my journey, because going back and forth a little bit, my journey, you said it was the ideals of the parents that are supposed to teach, which I can agree to a lot because my dad, he was in the military, so he was always traveling about and always brought something home and tried to, show us that, hey, there's more to life than just what you see in this kind of small little box. So he'd bring in stuff from like, oh, I'm getting a phone call. I'm going to not pick it up at the current
Yeah,
second. So
you don't
I
need to talk
yeah,
to
I was
them
gonna,
right now.
yeah. But yeah. So, it's. I guess it's that feel. So he was just kind of showing us these various different things and the different music that we would listen to and such like that. But it was to go back to the music thing. The very first song I can remember ever really listening to was online. It was some random pop song. It kind of like it really.
So
it
you're
really,
telling your audience the very first
Yes,
exposure to
very
music was
first.
online for you.
Yes, it
All
was
right,
on the
generation check here.
yeah, generation check. I know. But
So you don't remember singing as a family?
we did sing as a family. Yes. I'll say this song was the one that clicked for me because we sang
Right.
songs. There
Yes.
was the classic Christmas songs, the Christmas concerts, then the family singing time. But the song that clicked for me that kind of got me thinking, thinking, was some song that I had listened to on the internet. And it got me to think in this certain way, in an artistic way even, because I wanted to be an engineer for the longest time. And then after a few events that happened, and then this song that I listened to, it was like a whole nother world because the song led me deeper into what I'm into now today. But the reason why I was saying that is because most of the kids are listening to songs that they can either relate to or that click
Sure,
with them
sure.
and keep their thoughts in check, which I would assume you did too with your songs. I know you said you played like banjo, guitar, and that other instrument that you were talking about.
Lots of instruments, but you make a good point, and that point is that people are more, let's just say, receiving of learning between certain ages. In their musical learning, they used to say between the ages of 10 and 19. And I think it's expanded on. Of course, it's not set for every individual. I know, but I used to teach. Well, I've been teaching guitar and other instruments for more than 35 years. And a parent might bring a child into the studio or into the store where I was teaching, depending on where I was, and say, "I'd like you to consider this child for music lessons, for guitar lessons." And I would kind of do an assessment and either say yeah or no. Now, typically, a child's physical attributes to play the guitar, the fingers aren't strengthened yet at age 9.
Yeah.
But there are some exercises that I do to help to strengthen the fingers, and technique is very critical at that point.
Okay.
So you have to make learning fun.
Yeah.
If learning's not fun, the child's not going to learn. or he's going to learn something that you didn't want him to learn.
Yeah,
You know, like, oh, schools. What'd
Yeah.
you learn in school today? Nothing.
Yeah,
I mean, how
like-
often do you hear that? You
Yeah,
know,
like-
because it didn't
Engage.
excite them.
Yes.
Like obviously the technology excited you.
Yes, because I will say back on your story when you said 9 years old that they don't have the finger strength. On my last episode, I was talking to Ray. I said, or no, I don't think it was Ray. It might have been the episode before that one. I was trying to play guitar, and well, I didn't know I probably didn't have the finger strength, and I don't know if my dad probably did either. But hearing that, I was like, I would not have known that because at 9 I started, didn't know how that worked. I was using technology to learn, and I was like, this sucks. I hated it. Picked it up at 12 again and was like, I like it pretty much. But yeah, so because then also back to the point when you said that they wouldn't like learn, that they didn't like what they learned basically. But I'll say to that fact, when I think about it, they probably think about the ways to kind of get over on certain things that they don't like. I say that
Right.
that's probably
A child's going to, or anyone, not
Yes.
just a child,
Yeah.
an adult too, is going to find some accommodation or some compensation for what they want or don't want to do.
Yes.
And this is very behavioral focus, I guess. But there is a reason that we do everything. If I have an eating disorder, I'm going to be, eating,
Eating.
and there may be some brain chemistry that's out of balance. Yes, but there's also some behavioral interventions that can be done. So music is medicine. I said that before. A wonderful book that was written by a colleague that I've met maybe 2 or 3 times at conferences.
Oh,
Christine Stevens is entitled Music Medicine, and it engages the various parts of music. It engages sociologically how music heals. It heals persons who are going through war situations. She worked in Kosovo. She worked in the tribal, the aftermath of tribal wars in Africa.
Oh.
And probably experienced more of that in those situations. How much more now we can see now with online videos of people in the Ukraine
Yeah.
in shelters playing music, singing,
Yeah.
using their voice. If I got out here on this public street and started raging against everything in the world and,
Yeah.
shouting and carrying on,
Yeah.
I might be invited, maybe you want to come over here and we can do an assessment to see if you're,
Yeah.
in need of professional intervention.
Yeah.
But if I got out here on the street and started raging against the world, playing my guitar, I might just get tips in my guitar case,
Yeah. Well, yeah.
So music provides a socially appropriate way for people to express how they feel.
I mean, thinking on that, because I will say I am learning a lot, and I am enjoy learning a lot from you, because I'm like, this has been very interesting with all the knowledge that you have with how music affects, behaviors of people, and how it, even invites, I guess, different ideas for people to have. But the main thing I was thinking when you said that whole raging against the world, making it like appropriate in the music sense, it's like that's when I think back to at least around this area, I kind of feel like a lot of the get myself back into it, but a lot of those kids that you would say, raging against the world, and they don't use it. I kind of feel like that it should be more of that option, when they have a bad day, that they should just kind of write a song about it, like all the big people do now.
And you can say they ought to just write a song about it,
Yeah.
but they don't know where to start. And that's one of the things that a music therapist can help them do, to help to process that, or even just to provide a simple chord regression, progression, whatever you want, and to help to resolve that.
Okay.
So if I sang a scale and a child had do re mi fa sol la ti, the child's going to add that do to resolve the kind
missing link, I guess.
Yeah, the missing link. They want to resolve the tension.
Yeah.
Right? Because that's what music provides. It provides tension and resolution. It provides a movement away from the tonal center, and then it provides movement back to the tonal center. So that's why I use the term regression and progression. So regression away from the center, progression back to the center, and then resolution. Not all music does that. The latter part of the 20th century had music, or the mid part of the 20th century had a lot of atonal music, which people couldn't wrap their heads around.
Yeah.
So music history is a very fascinating
Yes.
thing to do because it shows the person's response to music. So getting back to Johnny in the classroom, how does Johnny learn? How does Julian learn? Well, Julian learns things that interest him. If I can prepare a child through music to read, if I can use music to teach mathematical concepts, and I do, if I can use music to help with language skills, even grammar, dare I say it, because so much of the lyrics we have now have thrown all the rules of grammar out.
Yeah.
But you ask a child, do you ever diagram sentences? Huh?
Yeah. I was kind of thinking Han too. I was like, I have never heard of it used in that way before.
No, but you can and I'm not going to limit this to music, because to use a diagram, to use an art form, and I'm going to include dance. I'm going to include visual arts as well as performing arts. Okay. I'm going to use the written arts. That may just be Julian or Johnny sitting down and writing something or filling in a blank. Okay. To make the resolution. I'm going to lay down my
head
down by the
river.
Yeah, right. So you can take an existing song and recreate it to make it yours. Instead of Woody Guthrie's song, "This land is your land, this land is my." We all know that, right?
Yeah, everyone knows that one. Yeah.
What about somebody who's trying to recover from an addiction, or they're in their recovery, or in their recovery from depression or anxiety? This life is my life. It is no picnic. It's got good and bad days, but I'll stay in it. So you're just adding when I am, and then you let people fill in their own blank. So they're writing their own story.
Okay.
And they're engaged. So when wah, wah, wah happens to Julian or Johnny, all of a sudden they tune everything out. They're not going to be so responsive to the therapist because they've been talked at all day. A good therapist is just going to shut up and listen, right? Yeah. And they do that. They do that. And then help process. But if a child is engaged musically, and that music activity helps them socially, relationally, parent-child, then you've got something. Then you've got a key element to learning. You've got relationship.
Okay. Well, that sounds amazing. I know
plausible.
I'm still in my head processing something, because I'm like, this is so much like information. That's why I'm glad that I recorded it, because I can now go back and be like, so this is probably what he was meaning when he was saying certain things. But because when you were talking about the whole filling the blanks thing, I kind of started thinking, I'm like, that is a I guess, an addicting way to kind of get people to respond because it kind of felt.
It's a practice.
Yeah,
I would.
was
I mean,
weird.
it doesn't have to be addicting.
Yeah, well, it felt. I know I say it weirdly, but yeah.
But it's a discipline.
Yes.
Okay. Yeah.
Yeah. So that's kind of. I'm not. That was very interesting. I will say that really opened my eyes to kind of thinking in I guess a different way to kind of, if I'm trying to convey something or get something out, get some ideas going. That's, I guess, and now I have another strategy under my belt to kind of think about. So, that's.
I think it's worth.
interesting.
I think it's worth the listeners' time, all of our times,
Yes.
to understand as much as we're able or interested to this just simple stages of development.
Okay.
In understanding that learning milestones being achieved through whatever means are helpful. And if a child doesn't achieve a learning milestone, a developmental milestone, they're going to be less likely to succeed in the next level.
Okay.
I may be fixated on something at a very early age. I may, as a child, have a relational problem, or I haven't made that connection.
Just yet. Yeah.
I haven't made that emotional connection, and that's going to inhibit my ability to receive further instruction. That's a problem.
Yeah.
That's a problem not only in our schools, but in our homes and in our communities.
Yes.
So music helps to treat the whole person, body, mind, and spirit. And it's the spirit oftentimes that gets neglected.
Yeah.
We are spiritual beings, but yet we suppress that because we need to feel safe. Ray mentioned last week, I think he made reference to Maslow's hierarchy of needs,
Yes.
right? That unless those safety and security needs are met first, we can't go above that and
Yeah.
meet our love and belonging needs, to meet our other fulfillments, and to eventually, achieve
The
whatever the
self.
pinnacle.
Yeah. The self thing. Yeah. That is very interesting. I hope that everyone listening is also just like me and just like, I'm becoming a little more knowledgeable on certain topics and how certain things work, and understanding where to meet somebody versus expecting them to already have something already in place type of ordeal. Because it sounds like to me that most of your, I guess, experience is meeting them where they are and just kind of helping them process it.
It is music. As far as the work that I do, is simply using music interventions to address non-music goals. I'm not trying to make somebody into a musician.
Well, yeah.
I'm not, but I'm recognizing the music child within them.
Yes. Appealing that different.
So I would say to the listeners, not only stay tuned for further discussion on Midshore Midday at some point with Bruce Patrick about music therapy, but in the meantime, if you want to learn more about music therapy, perhaps how you might find a music therapist, have music therapy included in your child's IEP or 504 plan, or to engage your child in accommodated music teaching skills. Yes, music therapists do teach.
Yes.
So having music instrument lessons that are accommodated to meet the child's needs are done. They can go to musictherapy.org. That's musictherapy.org. Maybe you'll put a link on that. On that. And that's the link to the American Music Therapy Association. It's not my link. I don't do a web page, but you can find there's a tab there right on that front page. On the left, I believe, says Find a Music Therapist. And you click that tab, you put in your zip code or your city, and anyone, anywhere in the United States can find a music therapist that way.
Oh.
It'll be a drop down. Here's the music therapist in your area. Music therapist? I've never heard of such a thing.
Yeah, I know.
I've never. It seems to make sense, but why music therapy?
Yeah.
Why music? Why do we bring music therapy into our practice? Why do we bring music therapy into our homes, into our schools? Well, it's for the learning, it's for the relationships, it's for the cognitive and emotional states, it's for self-regulation. Johnny can't seem to sit still. No, because he's got the rhythm in him.
Yeah.
Here's a little story. Miss Parisi was my 7th grade English teacher, English grammar, the one who really taught me diagramming sentences. And I was good at it, But, when we were sitting at our desks, what was I doing? I had my pencil. What was I doing? I was tapping my desk.
Oh.
Well, I won't get up and model Miss Parisi, but she had her glasses down on her nose like this, and she was all of 5'2", maybe.
Oh.
And maybe.
Maybe.
And she would get up on her tiptoes and she'd be writing on her. She was giving us demerits for disruptive behavior. Now I got disruptive behavior because I was tapping my pencil, drumming it on my desk, and it left a little mark on the desk too.
Oh.
Defacing property.
Ooh. Yeah.
I mean,
on everything.
even if I wiped it off.
Yeah.
But I remember. I think she called my mother in for a teacher-parent conference, right?
Oh.
And I was there. Well, Tommy is over here, Tom, or whatever she called me. I don't know. Tom was over here tapping his pencil on the desk, and I went from an A to a D for a 6-week grading period because of demerits.
Dear Lord.
Yeah, that's pretty severe.
Jeez, yeah.
And my mom wanted to know why. It's because see, all the demerits. I checked him off. He was off task, to use today's vernacular.
Oh.
He was off task behavior, but that's the way that I was thinking. I was okay. I got this, and I tap a little bit more.
Yeah.
So was I the poster child for ADHD? I don't know, but I didn't get the Ritalin. I know that.
Yeah.
But no. So why can't your child be still? Because he's got the music in him. He needs to express that music. Tapping on the desk was just the tip of it. No pun intended. And my mom just listened to Miss Parisi and smiled and nodded her head. She knew where I was at. She knew that this was the kid who was playing at her feet with the pedals on the piano, listening to Brahms, or standing, trying to get his balance, standing on and holding onto the keyboard when he couldn't even see over, the keyboard, right? So the needs of the music child were met. Now, how did I manage that? How did I become a music therapist? Who knows? I can remember I had a pretty good idea, but even before I became board certified, I was practicing the use of music as a behavioral intervention, as a way to increase socialization, if you will. My wife tells me of a story in which she observed from a hallway a meeting room at a library in Southwest Virginia, where I was at the time. And she didn't know what music therapy was, and she was just kind of curious, and she was kind of watching this group of people that I was serving who were living in Southwest Virginia at various places, residential homes or group homes or whatever. And she observed this one man who was very almost catatonic, and just bent over and not responding to anything. He was there, they said, you got to go to this, and he was there, but he wasn't responding. And then I began using the drum. Again, rhythm is the energizer and the organizer. So I began using the drum, and she watched, she told me later, as this person raised their head and actually turned and looked at the drum, and then subsequently became engaged and started playing the drum.
Oh. Hmm.
This was a person who was not engaged, probably over medicated,
Oh.
in my experience in working with him. But he became more involved and then started talking and asking for what he wanted. Well, that's pretty significant
Yeah.
because too many people, when they feel helpless, they don't know to ask to be helped or to express what they want or what they need. Even Johnny in the first grade classroom.
Yeah. Okay. Well, that that is amazing. One, I did enjoy the stories. I'm seeing how music really just kind of influenced really every experience you've ever really had and why you're so like into it. Like I can say for me, like I know, like at least because in the age of technology, most of us have our headphones on, our earbuds in, and I remember the question being, why does every kid have their headphones or earbuds in? And I guess your I guess view, it would be because they have the rhythm. I guess they're kind of listening to.
I think the bigger question to ask is why are kids tuned out in social relationships? Why do kids feel alienated and alone?
Okay.
Pandemic,
Yeah.
virtual reality,
Yeah.
headphones plugged in but tuned out. And we've experienced that in the classrooms. I've seen kids in treatment who are severely suffering social anxiety, generalized anxiety. They don't even want to go out into the stores
Ooh.
because of fears of having to interact with it. Because they've been going to school or not going to school virtually for 2 years.
Oh.
And they're either plugged in or plugged out.
Yeah.
In the 60s, it was, what was it? Turn on, tune in, drop out. Well, now it's tune out, drop out.
That's just it.
Yeah, and there's no motivation. So unless you have a motivation to learn, wah is not going to help you. Unless learning becomes fun and fundamental,
Yeah.
you're not learning. There's no motivation to learn.
Yeah. That makes sense. I know that I will say I enjoyed the talk because I'm looking at time and I'm like, oh Lord, we're not over. We're getting close to that hour. But because if you guys don't know, earlier he said, oh, I don't know, I think I might only have about 15 minutes of me. I'm like, I don't know about that. You got yourself up to an hour.
Well, I'm very passionate about helping children and adolescents.
Yes.
And adults.
Yes.
I'm very passionate about using music as medicine because I've seen the results. The results are out there. You can do the research yourself. I hope you will. And then maybe we'll explore this further in another venue. And maybe someday we'll come back here for your little projects and
Yes.
and do a little demonstration.
Yes, yeah, I can't wait because I know that this has been an hour. This has been Flowdoe. Want to thank Tom Gurney again for talking. I understand that he was very passionate about this. Hopefully, y'all got to learn a little bit more about him and his work and learning about this cool little world that I never really thought of, because I just kind of thought of music as just a thing to, get me by on some days when I'm just like, probably not in it, or just as a little pastime when I'm editing a video or something like that. But yeah, that is something else that I never really thought about.
So now I hope maybe that you'll be in the mindset of using music more intentionally.
Yeah, most certainly. Yeah. So, so it has been an hour, and it has been an awesome and very entertaining hour, I will say. That was great. Do you have anything else you would like to say before in closing remarks? I guess
No, if you see me on the street with my guitar case open and ranting and raving, I hope you won't lock me up. Just throw a couple of dollars in the busker's cup, and we'll carry on from there. Okay.
All right. Cool.
Thank you very much, Julian.
Yes.
We appreciate you.
Yes. thank you again for being on my show. And that is this episode of Flowdoe. And hopefully, you guys do tune in for the next one.
Peace out.
Yes.